Medicine Dispensing System's patented POS system allows clinic operators error-proof transaction tracking during over-the-counter exchanges. Simply click on the icon on the desktop application to open the program. Once in, the program asks for the operator's password. Upon password verification, access is granted to the operator, and they can search patients' records, inventory, reporting, and program configuration. Patient's information and transaction history are kept in order as the patient's first name, last name, membership date, credit balance, and physician authorization validity are accurately displayed within the system. Adding new patients to the system is quick and convenient. Operators are asked to fill out a questionnaire comprised of general information about the patient. Patient information is stored in the system and cannot be altered by the operator if that patient has had any transactions. Once the information is successfully inputted into the system will ask the operator to encode a magnetic stripe card that will ultimately be given to the patient at the conclusion of registration. Once the card is encoded, a fingerprint sample is taken at the program registration console. This is done to verify the patient's identity at the time of purchase at subsequent visits. All patient information is securely encrypted within the software. The operator is then asked to input the physician contact information, expiration date of the physician's authorization, and initial monetary amount applied to the card. Once the patient is issued a card, transactions are tracked with ease. Patients simply have the clinic operator swipe their card, and their unique patient information will appear on the screen. The patient is then required to issue a fingerprint sample that is verified by the program so that abuse or misappropriations of patients' identities are never an issue. Once the patient has been verified, the clinic operator is allowed to process the transaction. The system saves time, allows for the utmost in legal compliance, and creates transparency that will allow law enforcement to rest assured that abuse has not occurred. The system limits amounts dispensed and does not allow a transaction to occur unless the physician's authorization expiration period is valid. Once the transaction is complete, a receipt can be printed to give to the patient for their records.